Harvey, I'd like to ask you more about, like how do you see AI in medicine and especially in emergency medicine? Because, some of the work that you have done in the past before AI and after AI connects to that. I see you.
Awesome. Okay, well, I'm sharing my screen. Hopefully, you guys can see it. But big picture, okay, can you see my screen or not yet?
We can see, but barely read the small text on it.
I'll just make it a little bigger. So I'll be quick, and I just started the timer. So I'm going to start with some of you guys already heard of this. A little boy that basically saw 17 doctors over 3 years complaining of leg pain. The mother went to ChatGPT, entered all the medical notes, MRI, and ended up being that the child had tethered cord syndrome, and it was suggested by AI. The neurosurgeon went back and looked at those films and said, yeah, we missed it, and it is. And so I'm going to start off with saying, hey, we need to use this AI and plus human, because that's going to be better than the human. As an ER doctor, I work nights, weekends, holidays, all that good stuff, but I'm not at my best. So having an AI to help me keep up with all the information that's coming at me, for example, medical data, some studies say have doubled by every 30 days. And so, big picture, I need to use evidence-based AI versus intelligence-based AI versus evidence-based to help me keep up with this knowledge. As an ER doctor, it's so important to be able to communicate with my patients. So I'm telling my patients, I'm fine with you bringing a GPT like MediHelper to help you ask the questions and know what to follow up with. And then together, you're using the computer and we're able to use this information to get a better yield. As far as discharge instructions, I'm advocating to all my doctors to go ahead and revamp their websites, their discharge instructions, use AI to go through and then use that again, that concept of the doctor plus AI to create a better discharge. So now that obviously I'm not just saying, hey, let AI hallucinate and just give that to the patient. No, have it create it, look at it, and then have the doctor verify that information. Another quick idea that I really love came out of England. They took current discharge instructions for a child, converted it into concepts, and those concepts made it into a coloring book. And instead of giving the parents sheets of paper, they actually gave the parent a coloring book that would go over the proper use of an inhaler, the what to know about asthma. And now the child in a 5-year-old language, the ChatGPT can talk to it in that language and show them illustrations, and now the parents can color with it. Now, the big picture, yes, we are worried about misinterpretations, hallucinations, bias, and I'm going to jump into the legal. That's the biggest part right here. Damn if we do, damn if we don't. Doctors are going to be sued for using AI, but then doctors are also going to be used for not using AI. And so as we move forward, we definitely need to have some kind of decision tree to help our patients understand, hey, this is ChatGPT, this is the hallucinations. And so this is out there that I wrote in a book, and I give it away for everybody. But on the legal side, I know we were talking about this prior. Obviously, we got to worry about HIPAA and GDPR outside of the United States. And the executive order by Biden has already created many things that we need to be aware of. And so the last thing, because I know I'm getting close to my time, is that the government is having us make sure that these things are going to be implemented here in the near future. And we need to be obviously transparent with our AI. We need to show how our predictive analytics are working. And then in order to be certified, we need to make sure that these biases have been addressed, that we're making sure that it's transparent, that we can prove how this black box is actually working. And so by the end of 2024, we need to make sure that all these things are able to be done so our developers are aware. And like the other doctor mentioned, if we're going to be making life-changing decisions, we got to make sure that these tools are adequate. And so real quick, I wrote some healthcare GPT cheat sheets. Just hit me up on LinkedIn. They're free, and I'll pass them up. And then there's my information. So, but we'll continue. So thanks.